And now something completely different.
Good afternoon. I'm speaking to you live just outside
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Hey guys, welcome to the show. 888-659-3727 is our toll-free number. Thank you so much for hanging out as usual. A few minutes late, that's just the way that it is. We are internet broadcasters. Is everything okay with Joe Tillman? Can you hear me, Joe?
Yes.
Okay,
yes.
Good. If you're new to the broadcast, don't know who we are, who I am, and who the guy on my left is, or your left is, my name is Spencer. Nice to meet you. I am the founder. Hi. I am the founder of the American Hair Loss Association. I'm the author of the two most read volumes on the prevention and treatment of hair loss in the world. First being The Bald Truth, and the second, I'm not going to go with the subtitle, but in the second is The Truth About Women's Hair Loss. Believe it or not, those books, the last edition of both of those books were published in 2000. The original book was published in 1998. We are talking now 21 years since the initial publication of The Bald Truth. And I got to tell you, it may have helped a lot of people, but things really fucking suck. They really do. This industry is crazier than ever. I had a really cool guy in studio on the air last night or yesterday afternoon. He is a recently accepted IAHS member. We will get the information out about this doctor when we get the segments out. This is not a broadcast just to plug this particular doctor, but I got to tell you, man, this guy fucking got it. This guy came in, he sat down, he's just like, what you are doing and what this organization is all about, the IHS, is probably the most important work that's currently being done in the field of hair transplant surgery. And I got that shit on tape.
He can't go back now.
He can't go back now. But what that says, and it really does, it re-inspires me when I hear things like that, because this is a guy who really cares about his patients. This is a guy who really cares about this field. This is not I would have to say that a lot of the guys that we've worked with over the years are very one-dimensional. This is a very interesting young physician who does a lot in his life besides just this one-dimensional, surgical aspect of hair loss. Let's put it that way.
Okay.
And he's just very open to innovation, and most of all, he's very open to the truth. This guy said shit on the air that I could not even believe was coming out of a physician's mouth. The kind of shit that we talk about all the time on this broadcast. That's never happened before. Yeah, I have guys come in here, I interview guys, and they talk about the problems, and but they really try to couch things. There's a little bit of fear that they'd be going against their peers, or that they'd be looked at as potential whistleblowers about the industry if they were to say certain things. This guy did not give a fuck. He didn't go undercover. He was face forward, and he essentially said, look, patients are in trouble. I'm seeing them come through my doors every single day. The guy was naming names. I got to cut some of that shit out because it was really over the top. But he had no fear. And I really admired that, because all these guys, like he said, they will contact us, they will complain to me, they will complain to you, and then at the end of that conversation, which could be an hour sometimes of bitching about somebody else, they'll be like, but don't let them know I said anything.
But I didn't. But we weren't talking about it.
Yeah, we didn't have this conversation.
I didn't tell you this. Yeah,
this guy could be ostracized by the so-called hair transplant community. But, as we were talking about it, it's like, what do I care? This is the community. What we're doing, in his mind, is really the important community. And I'm like, motherfucker, this guy really gets it. So it felt really good. It gave me a little bit of, inspiration. And it really kind of spoke to what we've been doing and we've been talking about a lot. And to hear it coming from a physician, it's pretty rare. So I'm excited to get those segments out. We interviewed for about 2 hours yesterday. And, I don't even want to get him in trouble now, so I don't want to mention his name until he's actually saying the stuff.
Well, yeah, let him be the first to.
Yeah.
Let him. Yeah, exactly.
Yeah. That's how I feel about it.
Let him have all the thunder.
Let him have all the thunder. But I will say that it really does.
But don't tell him I said that, though.
I won't. I won't. But it really does speak to the fact that, believe it or not, there are some really ethical, caring doctors out there.
Oh, yeah.
But there's so few. And even the guys who are doing good work, even IAHS members, guys who have been, in the trenches for a long time, guys who have seen it all and are really trying to do good work for patients, they're concerned about the politics. Some of these guys are concerned about kind of speaking out of turn and getting the old school guys and the old guard upset with them.
And that's something that I don't really understand. Look, if I were a hair transplant doctor, my goal would be, number one, patient care, knowing that the better the patient care, the better my reputation in the industry and my respect and, the whole 9 yards. All of that comes from just doing the right thing. I wouldn't give a fuck about what anyone thought as far as my colleagues or any organizations, or if anyone didn't like what I was saying, if I felt it was the truth. And it's like, for that mentality of someone to actually pick up the phone and give you a call or give me a call. And docs that are listening to this that I've had these discussions with, we've talked about this as well. Why aren't you speaking up? Like, if this is such a concern, why aren't you stepping up to the plate and letting everyone else know that this is a concern, or at least getting, the unspoken concern that everyone knows about out in the open?
Right.
I don't get that. It's like,
well, there's a political fear. A lot of these guys, there's a segment of these guys that really want to kind of climb the political ladder of this imaginary. I mean, it is an organization, the ISHS, but it's almost like this imaginary. I don't know. I'm trying to find the words to describe it without being totally insulting. It's a culture that is really just important to the 1,000 or so people who are part of that culture. The rest of the world doesn't give a fuck about them. And they are not respected, sadly, and not saying they shouldn't be, but by the mainstream medical community. They really get no props from anybody outside of this particular field. And I think that really speaks to the way things were run. They wanted to kind of keep their heads down. They wanted to have kind of keep things on the down low so they could control the way this industry is run and the way that the practice of this particular specialty of medicine is performed. They didn't want any scrutiny. So because of that, they kind of made themselves like the redheaded stepchild of medicine. And it's unfortunate, and it continues to go down that route. Anyway, guys, we're going to take a phone call in a second, 888-659-3727. But this guy said something very interesting. He was talking about all the awards these guys give each other and pat themselves on the back and then turn around and use these awards to market themselves as though these awards that are given out at these meetings mean anything in the real world. Some of the biggest butchers in this field received some of these so-called awards for excellence in this field. And some of the biggest names, and we're talking about this I don't want to say ad nauseum, but for like 25 minutes, that when he got into the field, 12 years ago or whatever, he would have this reverence for some of these guys, and then he would see the work come through their doors, and he's like, these guys are doing this type of shitty work?
Yeah.
And I explained to them the only reason they have names is because they wrote the textbooks. They were willing to do the legwork as far as being the first to be a part of these organizations. And they, there was a time when the industry was so small, a very small handful of doctors were doing hair transplant surgery. And while it sucked, they were still the first.
Yeah. Yeah, that's an angle. But what you just said that he said about the awards, it reminds me of the first time I saw this for myself. I was at a conference with a smaller organization. Every member of the board of this organization got an award.
It's like the fucking Special Olympics, dude.
And I'm sitting there in the what do you call the
Hold on, again. It was like the fucking Special Olympics, dude. Sorry.
Good one.
Yeah.
No, I was sitting at my dinner table and I'm looking up and I'm like, so who's giving this award? And I'm looking at everyone up there. It's like, these are the guys that put this whole thing together. Like the guys that organized this meeting, this conference. And they're giving each other awards.
Yeah.
For I'm not even sure what the hell they're getting an award for.
Yeah.
And all the photo ops and the backs. I'm like, what is this about?
Maybe the award should be you fucked up the most people over the last 25 years, and you somehow got away with it. Now that's an award.
No, that's an award.
Yeah,
exactly.
All right, guys. Phone number 888-659-3727. And for the few good guys that are out there that are a part of these organizations, look, we're not talking about you. But let's face it, it's all. I mean, come on, get real. It's all bullshit.
Get real, man.
God Almighty! I mean, when physicians who really care are willing to speak about it and say, "Look, it's just nonsense." Here's the good news, though. They have the ability, because they've been able to create this veneer or this facade for so long, to actually switch it and make it into something really important.
Yeah.
They have the infrastructure, the legwork was done. They have the people who are able to make this happen. So why not go positive instead of continuing to stay negative and to, keep things, cloaked in bullshit? Sorry. Oh, God, I should not have had a
Feel
drink
better?
so early. Yeah. 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hey, man, what's up?
Hello.
Caller,
Hey, this is John.
Hey, John, where are you calling from?
I'm calling from Palos Verdes.
Palos Verdes. Wow, welcome.
Yeah, thank you. Thanks for doing the show. It's an amazing show. It's been so helpful for me. I appreciate it.
I appreciate that. Joe has a P.O. box where you can send checks. So, go to his website.
There's already one in the mail.
So what's going on?
I'm already, sort of settled on hair transplant's a good idea for me.
Why?
And because, I kind of, for the last 25 years, I've just sort of said, well, I'll be bald one day and it's no big deal. Because my brother was bald at like 23.
Yeah. So how old are you? You must be in your 40s.
I'm 47.
Okay.
47. Okay. Yeah. And, the problem is I was like, well, whatever, I'll be bald. I just look like, really bad bald. I'm kind of thin, and, everybody says I look like I'm going through chemo or something.
Yeah, it's not a good look. It's not a good look for a lot of guys. I would, and I say this, and you're probably relatively new to the show, but I would look like Kane from Kung Fu. You get the reference because you're old like me. But if I would shave my head, and it's just not. When people say to me, we had a female caller who was lovely, and she's unfortunately dealing with hair loss. She said, "Well, it doesn't really matter for guys because guys can look handsome without their hair." Yeah, they can. A small handful can. Most of us look fucked up.
Yeah.
And that's why I do this show. Category. Yeah, me too. Welcome to the club. All right. So tell me, what are you doing? What have you been doing to try to treat your hair loss, if anything?
I just started finasteride.
So you've been thinking about losing your hair for the last 25 years. You're at the point now where you think you look like shit because you've lost so much hair. What made you
Yeah, like maybe I should have, 10, 15 years ago started using it, which I considered, but I just was like, I'll go bald.
All right. Well, listen, here's the good news. At least you didn't start off in a panic like I did. So you were willing to accept the reality of losing your hair.
Yeah, I tried to go that route.
Yeah, and that's cool. I mean, that's actually, that shows that you have a certain level of, confidence. You were equipped, at least you thought you were equipped to deal with it until you saw the final result, and you're like, oh, fuck. Well, and
I feel like, look, until a month ago, I was sort of just like, well, I guess I just had to live with it, until I started doing a little research and saw how good a hair transplant can actually be. And I was like, why would I choose to be bald if I actually have the option to have hair?
Well,
and I understand there's risks.
Yeah, and that's how I feel, and that's what we talk about all the time. My only thing is this: if you have lived, and again, Joe, I want to want you to jump in a second because I'm falling asleep, to be honest. But no, what I think is really important is you're equipped to deal with it. You're willing to accept it. That's a big thing. Mm-hmm. Would you be willing to accept being botched if, in fact, something went wrong? Would you be willing to accept being disfigured if something went wrong? Not saying that it will. There's a great chance if you do your research, you're going to have a decent procedure or a great procedure. But there's always a risk when you have cosmetic surgery. So I guess my question is, would you, if you had the choice of living your life the way you're living it right now, or living it disfigured to some degree, even if it's not a major disfigurement, but like, a widening scar or bad FUE or something, what would your choice be?
Yeah, if I was choosing between those two, I would choose the way I am.
Okay. Well, right now, the way you are is the way you are, so there's no chance of being disfigured.
It's true. But I'm definitely a risk taker.
Well, listen, here's the thing. You can mitigate that risk, and you could really make a well-informed, educated decision, and there's a good chance if you are a candidate that you're going to be fine. But you just need to know that the risk is on the table, because the way you just expressed yourself was, well, if I don't have to be bald, why would I want to live this way? Because there's incredible new technology. Not the way it works, dude. I think hair transplantation can be life-changing. You look at Joe Tillman, you look at his head of hair, this guy is bald as fuck in reality, except, well, he should be, but he looks really good because he had some great repair work, great hair transplants, and this is why he does what he does. So it's very, it's possible and could be life-changing. But Joe, I want you to, you heard what he said, and again, caller, we'll let you, your name is John, by the way?
Yeah.
Yeah, we'll let you ask some more questions, but just based on how he came on the air, Joe, what are your thoughts? Because I got a vibe like he's just starting to do his research. He thinks everything is fucking, he's all Pollyannish about it.
Well, I think it's pretty simple. I'm opening a new clinic next week, and you're welcome to come up and be the first client.
I actually wish you would. At least it would be a decent clinic.
I'll give you a cut rate, only $10 a graft, and a minimum 5,000 grafts over a half-day session. Just kidding. Well, you said something really, really key in this exchange you had with Mr. Kobren, and that was you've been living with it for 20 some odd years. I'll go bald, but then you saw the technology and what it can do, and now you're looking into it and you think, well, it's time to do it. You were fine until you saw what can be done. You weren't losing your fucking mind over this. You're living your life, and I imagine
I'm living my life.
Pretty happy with your life as it is.
I have a good life, but I am always kind of bummed when I look in the mirror. I just said, it definitely crushes the soul a little bit.
Well, that said, that's pretty powerful.
Yeah, well said. But let me ask you this: what is your hair loss like right now, and how do you wear your hair? What kind of hairstyle? Like give us an idea of your appearance.
My hairstyle is like a number 3, just kind of buzz.
Okay.
and my hair loss is basically, it looks like somebody sort of drew a line from one ear across my head to the other and got rid of all the hair on the front.
Okay.
Does that make sense?
So, have you considered going shorter with your haircut, like doing a 1 guard or even a 0 guard?
Yeah, I've gone down to a 1 or 0. But again, I just, it's the cancer patient factor.
Well, why do you look like a cancer patient? That's I don't understand how a shaved head guy would look like a cancer patient. I can understand if your hair is longer and you're trying to do some, really useless comb over. That's where you look like a cancer patient. But shaved head guys don't look like cancer patients.
I think it's just because I'm skinny. I'm pretty lean.
Okay. Are you pasty white as well?
No, I'm not pasty white.
Okay. All right. Well,
All right.
I think,
so instead of so he's obviously bummed after speaking to us already. Let's talk about the positives of him possibly getting a hair transplant.
No. I'm not ready to talk about the positives because I need to.
Oh, okay. Hold on. I'll excuse myself. Go ahead.
I need to follow this line of thinking. So, you saw what the technology can do, and you said to yourself, I want some of that. I need me some hair now that I know that it's possible. So the question becomes now, and this is what Spencer was asking you, and this is the exact question I ask in hair transplant class number 1 on here on my YouTube channel. If you're watching, what are you going to do if it doesn't turn out the way you want? Like, how are you going to deal with a potential negative outcome? Have you thought about that? Has this crossed your mind? What if it doesn't work?
No, it has crossed my mind. And I guess that's the scary part is there's always some risk. And I'm trying to mitigate that risk by finding somebody who's has a low percentage chance of that happening.
What kind of work are you looking for? Have you had any consultations yet?
No, so that's the main thing that I really want to talk to you guys about is, I've talked to 5 different surgeons. And, what's weird is, and, with the exception of one of them, I think they're all pretty reputable.
Which one is that?
The not reputable one, it's called Barber Surgeons Guild, Justin Rome.
Yeah, listen, I know Justin, and he's a board-certified plastic surgeon, and he's a very nice guy. But I don't necessarily. I can tell you this: I have never seen any of his work, and I know that his clinic or his Metaspa utilizes an artist robot, and I'm not sure how involved he is with the surgery. He's never really told me. I've never really asked him, so I can't say, hey, that's going to be a good move at this point. But maybe one day, he's pretty close to me. Maybe one day I'll stop by and see some of his patients and be pleasantly surprised. Who knows?
Yeah, what scared me is he's the one that said, we don't really do graft counts. We just whatever it takes to get a good look, that's what we put in.
Well, and he's using the robot, he said?
Yeah. Yeah, okay. Using the robot.
That's interesting because the robot actually, they are the physicians or the clinics are charged per. At least that was the old model. To my knowledge, it hasn't changed.
That's what he was saying. They were charged.
They were charged per attempt.
So he's charged per attempt, but you're not.
Right.
You're charged. You're charged for what they get out that survives and they put back in.
Yeah, and then with him saying that, and then I have Hassan Wong saying that I need 3,500 to 3,800, and then I have Dower saying that I need about 1,500. There's such a huge discrepancy. It just makes me feel like, is everyone counting them different, or what's going on?
Well, I would tell you that Dower is always going to err on the side of caution. He's a more conservative, and when I say conservative, let's just say maybe it's appropriate physician, and because, I personally believe that going a little smaller, it helps you to mitigate that possible long-term big blowout damage. If you get 4,000 grafts and that fails, you're fucked. But if 1,500 grafts don't work out to your liking, then there's maybe a much better chance of you kind of moving on with your life. just calling it a day, or it's easier to repair. I mean, there's a lot of advantages to having a smaller session.
Sure.
You know, Joe?
And anytime you, first off, good for you for having 5 consultations with 5 different clinics. I think that's a great step. You got a lot more to go. But, you know, when you run into this situation where you've got some really great reputation doctors giving a lower estimate, and then some other great reputation doctors giving a much higher estimate for the exact same area, you probably sent the exact same photos to all these clinics. You're going to have a discrepancy because some clinics feel that they need to throw everything that they can at the situation for what's referred to as the one and done, meaning one pass, density is achieved, coverage is achieved, you're done. The problem is that sometimes when you do one of these one and done style approaches, it ain't one and done because you got to go back in for a second and done, if that makes sense, because maybe the donor scar was not great, or maybe the growth wasn't that great, or in FUE maybe the growth, you know, not so much a donor scar. But
Joe, I mean, one thing that I think we're forgetting to tell John is that depending on who you send your online consultation to, you may be being consulted with, you may be consulting with a non-physician, even if it's a great clinic, or you may be consulting with a physician. Now, I'm pretty sure Mark Dower does his own online consultations. So,
well, actually, I saw him in person.
Oh, you saw him in person. Okay. Oh, that's good. There's a guy that you might want to check out, and I'd be curious to see what he said. He's a young doc. His name is Amir Yazdan, and he is in Newport Beach. What I like about him is, just like Mark, he does all the extractions. This guy is killing it, I think, as far as he's pretty conservative. And I think that he could also probably give you something to think about as far as whether or not having a smaller session is more appropriate for you. Let's put it that way. So there are the guys, in my view, the guys that are doing the work themselves, the guys that are like actually hands-on with every aspect of the work, it's not just about the time, but they also understand every single nuance of the procedure, so it may be easier for them to actually more accurately assess you. Now, when you're talking about Hassan and Wong, if you're doing an online consultation, there's a good chance that they are not necessarily doing the consultation, and things can change once you decide to get on that plane and have the surgery. Now, no matter what, both Victor and Jerry are going to provide you with the best possible service and the best possible medical assessment, but they have to see you to do that.
Yeah.
Yeah. So they may change the number when you get there.
You may get there, and they may say you're only going to get 25 grafts, 2,500 grafts, not 25. That would be fucked up. 2,500 grafts. Yeah. Yeah. So, I mean, there's just a lot to listen. The IHRS was really created to provide a safe place to start to do your research. When you talk about the practice of medicine, that's why they call it the practice. Everyone practices slightly different. And when it comes to this particular specialty, there is a really no specific standard of care, meaning that everyone has kind of like their own creative sweet spot. People are they're basing their assessments of patients on their own clinical experience as opposed to something that's more generalized. So when people say, oh, you know, how come one doctor is telling me this, one doctor is telling me that? It's based on their own experience. Mm-hmm. So it doesn't necessarily mean that because one doctor is assessing more grafts that they're trying to sell you something. It just means that in their experience, in their particular practice, they believe that in your case, this is what they can do for you. So you have to put that into your equation as well. It's not necessary. A lot of guys come to us and like, well, I think this guy's trying to sell me something. That's not necessarily the case. It is all just based on their own clinical experience, and that's why you have to kind of figure out what's best for yourself once you have enough consultations and you kind of get a lay of the land.
Was your assessment from Dr. Dower and from Hassan Wong for strip or for FUE?
FUE.
FUE, okay. Just making sure.
Now, let me ask you a question. Did anyone even mention the possibility of you having a strip, or was that something that you just came out and said, I don't want?
Uh, yeah, nobody really even mentioned it. I mean, talking to Mike at Hassan Wong, we talked a little bit about it, but I think just based on the number of grafts, and maybe he just knew that I was leaning that way, that he didn't try to push it. But part of that came up because I was talking to him about FUE specifically, because it seems like they're really known for their FUT and not their FUE, where like Bobek he seems Baalbek. I don't know.
You didn't even say that you saw Bobek. He's great, man. He's another great doc.
Yeah.
You got a lot to choose from. If you're in the LA area, you got a lot of guys to choose from.
He recommended 3,000.
And that's something that he does in his practice all the time. So again, that's for him. He's also a former patient. So he has a unique perspective. And so does Mark, actually. Mark went for all strips.
Yeah.
Oh, he did.
Yeah. Now, what did you think of Mark's hair when you saw him?
I thought it looked kind of thin.
That's what happens. The guy should be completely bald.
Yep.
I know. But that's what I was thinking when I saw that. I was like, oh, my hair's going to be like that thin, and I'm like,
well, if you're completely bald in the front, the likelihood is your hair will be that thin. And when I'm in this world. So when I see Dr. Dower, I'm like, he looks pretty good. I got to say, for a guy who should be like a Norwood, I'd say probably about a 5.
I think about a 5. Yeah.
Yeah.
I've seen a couple times too, and we met. We've met twice, and I've always thought his hair looked good.
He has a nice looking head of transplanted hair, and that's the thing. That's what that's how you have to recognize it. It's transplanted hair. When you look closely at it, or what I like about his work is you don't really see that exclamation point hairline. While the density isn't what people imagine having a full head of hair is. That's a full-looking head of hair for a transplant. Yeah, could he have it refined a little bit? Sure, but it looks 100. I mean, wouldn't you say it looks 100% natural?
Oh yeah, no, it looks good. Yeah, I don't mean to say it doesn't look good. I was just like,
Oh, wait a second, Mark's on the phone. Hold on, Mark. He wants to talk to you right now. He's upset.
Yeah.
No, but that's the thing. And you have to have. And I'm glad that you met him in person, because you're talking about a guy who's had 3 hair transplants. That is a realistic. I guess final result for 3 hair transplants. And remember, the guy he's a little younger than me. I think he's about 50. So, you're what, 47?
Yep.
Okay, so now that you saw Dr. Dower's hair, you may think it's slightly thin, but how would you feel you look with that head of hair or that type of density?
Yeah, I think it would be a lot better.
All right, so that's it.
I think even just having my temples filled in would be a lot better.
So that's okay. So you have a realistic expectation now. So that's a good start. That's a good start.
But
go ahead.
But if Baalbek can give me 1,000 more hairs and make it a little denser, why wouldn't I do that? I mean, I guess the why was because it's more risk.
Well, there is more risk, but again, you have to go with what these guys are used to doing. Is Mark Dower used to doing 3,000 graft procedures? He's probably more of a 2,500 graft guy, 15 to 2,500 graft guy. But Bobak, and I always pronounce his first name wrong, but whatever, sorry, Doc. He is used to going in there and doing those many grafts, and he's involved with the entire surgery. So that's another guy that I think, that's pretty invaluable. So, yeah, I mean, that's a choice you're going to have to make. Just know there's a slightly greater risk, the more grafts that you use, that you could lose more grafts if that happens.
Yeah.
But if that doesn't happen, you're going to have more hair. And there's a greater chance that it won't happen than it will. So you have to just know what the risks are, and you have to just put that into your psychological equation when you go in to have this surgery. You can come away from seeing Dr. B and be like, holy, this is the best thing I've ever done. I should never, ever have been afraid and let Spencer scare me. But here's the good news. You are having consultations with some of the best. And most people aren't. Now, I do find it interesting that you went to see kind of like a non-core hair transplant surgeon, but I guess it was just you know.
Oh, you know what?
Go ahead.
Because initially, when I first started my research, I thought artist was the way to go. When I read about it online, I was like, wow, this sounds amazing. So I scheduled it with him.
So wait a second. You talk is a robot that does hair transplant surgery? That's how people think.
Yeah.
Here, this is the one thing. Listen, I put this out there all the time. I consulted for Restoration Robotics for 2 years. They brought me on board to try to help them evolve what they were doing, you know, with the device, to kind of help them have their finger on the pulse of what patients are interested in. And all I can say is this. There is not a device in the world that could perform a great hair transplant. It's the people that run the device. That's
it's
it.
just a tool.
It's just
That's
a tool.
all it is.
That's all that it is. I don't believe. Now, there are some tools that might be better than others, but the truth is, if a guy has a really great skill set, he can make a mediocre tool do a great job.
Yeah.
So it really is about the hand. It's about the people, and it's about the experience. And I think that's really important. I don't know if Justin, I just don't know how much time on tissue he has right now. I know he's been doing this for a few years.
It doesn't seem like he has much based on his portfolio.
Well, listen, then, you know, you just check that box.
Exactly.
You know?
He's off the list.
Yeah, all right. So you are 47 years old. Now, are you married?
Yeah.
Okay. What does your wife think about you getting this done?
She doesn't want me to.
She doesn't want you to. She'd rather have like a burqa bag than.
I was just going to say, she'd rather have the kitchen remodeled than have hair on the head.
Well, there you go.
There you go. But does she understand why you want it?
Thanks for calling.
Yeah.
We know where this is going.
I mean, does she understand that it's causing you, you know, it's crushing your spirit, that you're upset about the way that you look?
Yeah, I think when I explained it further to her, she understands.
Okay. Is she helping you with the research, or is she kind of hands off?
Oh no, I don't even talk to her about it.
Okay. All right. Well, this is the thing. Surgery's always going to be there, man. You don't have to rush into it, but what you were doing is smart. You're having a lot of consultations. I would find a couple more doctors in LA to have a consult. I think check out Dr. Yazdan in Newport Beach.
Okay.
Send some more online consultations to some other IHRS members. See what they have to say.
I was going to talk to Rahal. Is that how you say it?
Yeah, that's great. See what they have to say. You will get a truer sense of what's really appropriate for you, the more consultations you have.
Who all? You said 5 doctors, so you got the guy there with the robot in L.A. You got Ballback. You've got Hassan Wong. Who else have you consulted with?
And Alexander in Arizona.
Okay. Yeah.
Yeah, he's good. He's a really caring. He's a really caring guy.
Yeah, and then I have an appointment scheduled with Rahal.
Okay. All right. Well, you're like Spencer said. You got a good start to this. So,
Joe, why did you choose Wong over Ballback?
Ballback was
Ballback was 12.
Yeah, yeah, he was 12. Yeah. That's a great way of putting it. Yeah. Dude, my first repair surgery was in 2000. It was, 17 years ago now.
Okay.
He asked why you chose Dr. Wong over Dr. Hassan.
Well, I didn't actually. Mike was my consultant, just like he is for you. And just a quick story about this. I came in after seeing an MHR infomercial, and MHR, you've been around for a while, so maybe you saw their infomercials.
Medical hair restoration, Dr. Matt Levitt.
Matt Levitt.
Oh, no.
I was in my new apartment by myself because I'd just gotten separated from my first wife.
Drinking some
drinking myself into oblivion. I had my bed, I had my PC, and my TV, and that was it. That's the only thing I owned. And the TV was on the floor, and I'm just eating some ramen noodles or something. I was just in my misery, and on came this infomercial, and I thought, maybe it's gotten better since 9 years ago when I had the first 2 rounds of crap put on my head. So, but I knew better than to believe the infomercial. So I went online, started doing my search, and found Hassan and Wong, and called up the next day, made my appointment because they had a Seattle office, which is where I lived at the time. And that's when I walked in and met Mike Furco. And when I walked out of that consultation, I stopped and I thought, this son of a bitch just told me everything I wanted to hear. Oh yeah.
He's a hell of a sales guy.
We can do this. Oh yeah, we'll do 2,400 grafts, no problem. 1,800, 2,400 grafts. Yeah, brother, man, no problem at all.
That's how he talks, right?
Yeah, totally.
And if he's listening, I say this in jest because he's like the older brother I never wanted. But
no, he's like an awesome guy. I mean, he's very likable.
Very likable. The 110 proof breath helps too. But I'm just kidding, Mike.
So I went online and I started asking. This is my first foray into actually being an internet person. I started asking. Are they for real? And Mike saw me posting. This is when I used to post online as Joetronic. That was my handle at the time for many, many years. And he called me up and he goes, "Hey man, are you Joetronic?" I'm like, "Yeah." He goes, "Hey man, come on in on Saturday. I want you to meet someone." I'm like, "All right." So long story short, I go into the office and he had 3 guys waiting for me. All 3 of them were patients.
Was it Bob Man?
No. Yeah, Bad Man wasn't Bob Man by the time that happened there. That's my Bob Man impersonation.
I get it. No one else would, though.
No one else would, except Bob. But there were 3 patients, and one was 6 weeks out from surgery, and it was with Dr. Wong. The second was 6 months out from surgery with Dr. Hassan, and then the third was 1 year out with Dr. Wong. And I looked at the 1 year guy and I said, "This is a hair transplant?"
"Oh yeah, brother."
Okay. All right.
Yeah.
The guy had my kind of hair. It was fine. It was.
I didn't know that Hulk Hogan worked for Hassan Wong, by the way.
Well, that's a great. I never thought of that.
Yeah.
And that was it. And there was no discussion about the doctor because, I could have been. It could have happened again to me. I could have made another bad mistake, but I didn't because I at least got to see the work, and it was spectacular. Even back then, 17 years ago, it was spectacular. So
I got to tell you, I'd say Victor and Jerry owe Mike a tremendous debt because it was Mike who contacted me initially to get them on. This is before the IHS to get them on the Bald Truth list.
They should be giving Mike an honorarium for life.
Absolutely.
Just so he can go and do whatever he wants to, just retire. They should. They should be
really running that business.
What's that?
Seems like he's in charge of it. Is he running that business?
Oh, do not say that, man.
That's a can of worms right there. Anyway, so I didn't choose Dr. Wong. It was just a matter of who was available, and I was scrambling trying to get money together because it's like, I was going to do this again, and Mike called me up, said, "Hey, I got a spot coming up in 2 weeks. Are you interested?" "Sure." And then he told me, "Well, it's with Dr. Wong." "Okay, I already saw his work, so let's do it. And that was it. It was just luck of the draw. And
How is that for the longest answer in the fucking world?
I would not have traded that opportunity for anything in the world, because that moment when I crossed the border and came up here to have my procedure with Dr. Wong, that was the beginning of the end of my misery and the beginning of my foray into helping others. And I owe him everything. He did a great job for me, super happy, and I wouldn't have changed it for anything. So there you go.
It's a good story.
It is. I'm about to cry. Look, you found the right places. Go ahead. I'm sorry.
I mean, am I going to get similar work from any of these great places? Like,
who knows? I mean, it depends on your particular hair characteristics, your scalp elasticity, your scalp characteristics, your hair caliber, your skin caliber, your contrast between hair and skin. There's so many fucking factors.
But the doctor doesn't change any of that, right? Like, I mean,
no.
No, but the doctor understands how to work with the different. It's like an artist working with different materials. They can take the materials over here and create a masterpiece, but they can go over here and get this pile of materials and make another masterpiece, but differently, because they know how to deal with that material. If that makes sense. It's all about experience, right? I mean, you can have a guy come in that has the highest amount of raw talent in the world, and they can still screw up if they come across something that they haven't seen before as far as a patient characteristics. But excuse me, but an experienced hair transplant surgeon that also has a lot of talent will do a hell of a lot better job because they've seen this case before. It's like once you get to a certain point, it's like there's really nothing you haven't. It's like when I'm looking at patients online or even photos, I don't think I've seen anything new in 5 years.
And that's actually a really important point that most people just do not get. And also the device manufacturers and those who are just getting into the field do not market or do not talk about. Because the reality is, and we're talking about Mark Dower. I had him here in the studio, and one thing we talked about during that interview was every case is a surprise. And if you have enough time on tissue, you've seen most of the surprises. But these new guys who are just buying devices, who are not performing the surgery themselves, they don't know how to fucking handle these things. So they handle every case in the exact same manner. It is cookie cutter. So you may not be in that category where you can do a cookie cutter procedure, and sadly a lot of guys aren't, and that's why we see so many walking wounded today. So what you're doing actually, John, is you are having, for the most part, consultations with the best and most experienced surgeons in the field. Will that mitigate the possibility of you having complications? Absolutely. Will it guarantee you won't have complications? No.
Sure, that makes sense.
Yeah,
and I will add to what I was saying, or to answer your question. You said your original question was why did I not pick Dr. Ballback over Dr. Wong? Well, fast forward to today, if I were doing my research, Dr. Ballback would be in the running for sure. And this goes back to what I do today for a living. I work with multiple doctors, and the only reason why I have them on my website, the only reason why I'm so public about my affiliation with them is because I'd consider having surgery with them myself.
It's not for the money?
Absolutely 100% for the money. No. I mean, it's like, Ballback wasn't around back then, but I would have no problem today laying down to have a surgery with him because I've spoken to him many times. I know how he thinks. The guy is a hair nerd. He's a geek. I mean, he loves this stuff.
Cannot get him off the phone when you start talking about hair.
Cannot get him off. Yeah, I mean, his consultants are like, we don't want him to come in the office right now because he won't be able to finish the surgery that's going on because he won't shut up. He won't leave you. He won't stop talking to you. So,
well, I'll tell you how young Ballback is. When he applied to the organization, first of all, he got on the phone with me after it was a couple of months after he applied. And he was like, you have no idea what an honor it is to speak to you, Mr. Kobren, okay? Because he grew up, essentially, in college listening to the Bald Truth on the fucking radio.
Nice.
And he said it was because of the program and because of his experience, life-changing experience having a hair transplant, that he became a hair transplant surgeon. And it was because of the program that he chose to go in the direction surgically for himself that he did, and he said it changed his life. So this guy's young, but he is so passionate. It's hard to find someone who is that connected to this specialty. Let's put it that way.
Well said.
But when you guys talk about time on tissue all the time, and when I compare Wong to Ballback, like time on tissue, like obviously those guys blow them away.
Well, I mean, let's think
Dr.
about
Wong
it.
is also 72 years old.
Yeah, I mean, how much fucking time on tissue do you need? If you're doing this,
is it getting a little shaky?
if you
No, I would.
I think he stands on a stepladder though now. I am just kidding, by the way. No, he's great. But I would say, as far as time on tissue, it's like anything else. Once you're past the 10-year mark, you're good. You've had all the experience you need if you're performing surgery every day. You know.
Okay.
Now, if you are
and
a
keep
guy
in
who's
mind, he's doing this himself. Like he doesn't have technicians doing it for him. So, as far as FUE goes, Dr. Ballback actually has more time on tissue than Dr. Wong, because Dr. Wong isn't doing the FUE procedures, technicians are. I don't know if you understand that.
Actually, that's a very good point.
I did inquire about that, and I was going to ask you guys. I mean, do you feel like that's a decent I don't know, separating factor between the two?
Well, here's what I think. I think, listen, if it's legal, and the technicians are well trained and they're supervised by a physician who understands everything about the surgery, I think it's okay currently. However, there's something to be said about someone who has the willingness and, I guess, the know-how and the drive to do the surgery himself. That's all I'm going to say. There's something to be said about that. Now, I know that Dr. Wong would not allow anything to happen to a patient under his care, and he is absolutely observing everything, and he's part of the surgery, and he's right there, and he's guiding people. But that's a choice you have to make.
Let me interrupt you. I just want to make sure it's clear that he knows that Dr. Wong isn't standing there watching every graft being extracted while the technicians are doing it. That's not.
Well, wait a second, he's not.
No, he's not. No one is.
Do you think anybody actually thought? You're right. Actually, maybe the way I explained it, people would think that.
Yeah.
No. But he does have them on closed-circuit television. That's a joke. It's not even funny.
He doesn't even know what that is.
Is there still such thing as closed-circuit television?
Closed-circuit television, Jesus. It's hilarious.
I know what that is. Pretty old.
Yeah.
Look, I'll put it to you like this, okay? Knowing Dr. Wong's standards, having worked at the clinic for 11 years, I know how things are done there. I know that he would not accept anything less than perfection from his technicians, because there is a certain level of awareness about graft integrity at the clinic that I don't see at a lot of other clinics. But the idea of having a technician do the procedure or a doctor do the procedure, that comes down to, for me, it comes down to personal preference. So if you have a Ferrari, the latest Ferrari, or like say the rarest Ferrari out there, would you want the master mechanic working on it? Or would you want one of his underlings working on it while he comes in and just kind of pokes his head in and makes sure that he's not scratched the cylinder walls?
But also, the question is also this: is the technician the master mechanic in that room when it comes to this procedure? And that's what you have to know.
See, you're just complicating things.
But
man.
that's when
it was a perfect analogy.
No, but you have to know who the fuck is working on you.
He did love it. It was sounding really strong, and then wait a minute, they could be a master as well.
Absolutely, that's the whole point, though, man. That's why I think, and no doctor wants to do this yet, but I'm hoping that in 2019 we could change this. I think if technicians are going to be working on a patient, that the consumer should be aware of the technician's experience, how long they've had time on tissue.
Yeah, I think technicians' mugs and bios should be on the website. Meet your surgeon. Meet your extractor for the day.
I'm trying to get that done, but you know what's happening with these fucking docs? They're like, oh no, and then someone's going to poach my technicians.
Yeah, I don't want to even hire my technicians.
It's unbelievable.
Yeah.
Anyway, listen, you are in a good position because you're making the right choices as far as doing your research, doing your due diligence. You're calling the show, asking the right questions.
It's confusing more?
No, it's confusing. Listen, it's confusing, but the truth is, I think, you sound like a pretty smart dude. I think you can read between the lines. And the reality is, anybody can get fucked up, but you can mitigate that possibility by doing your research. And just know that if you don't know who's performing the surgery on you, in my opinion, if you haven't researched them in particular, I wouldn't have it done.
Which is kind of impossible to do with
it's not
tech, right?
It's not impossible. You could ask them for their credentials. You can say who's going to be working on me that day, how long they've been working with you as a team, and how long they've been performing FUE on their own. You can get all that
I did
information.
actually. I asked Austin along those questions.
Did you ask Mike?
Yeah, he said those techs have been there as long as he's been there.
Well, he does have tech. They do have. What's that look, Joe? What was that look?
I'm not saying a thing.
That was a fucking awesome Benny Hill situation right there, man. Now, I can tell you this. There are technicians that have been working there as long as Mike.
Doesn't mean I'll get that one.
There are a couple, yeah.
We're not saying they're not in wheelchairs.
But there are some that haven't.
Yeah.
So
you understand how old Mike is, by the way.
I heard the wife in the background. John,
are you talking about that hair stuff again?
Yeah.
Yeah, just listen, man. You know what we're talking about. Be fucking careful. Know who's putting their hands on you and who's cutting your head open.
All right. So
in other words, don't have a hair transplant.
No. He could have, if you want to have one, if you think you're a good candidate, you understand the entire scope and all the possible pitfalls, great. But for me, if I don't know the experience of the person who's actually going to be performing the surgery, I am outie. That is it. It is not happening.
Yeah.
Yeah, that makes sense. Awesome.
All right, man. Listen, good luck, and
keep us updated.
Look, even if you don't get the transplant, get a car. Don't get the kitchen. All right? Take care of yourself.
I agree.
All right,
I
man.
agree.
All right, you take care.
Thanks, guys. I appreciate it.
All right, bye-bye.
Thanks for calling.
Jesus, we just, what a tap dance that was, though. I got to say. That was a fucking tap dance and a half.
Oh, no, brother. All those techs been there just as long as I have.
Yeah. Jesus. Those techs, I mean, come on. Think about how young these techs are.
Hey,
these techs were 4. These techs were 3. You know?
Some of them are not quite so sprightly. But
okay, even if they're 40 years old, they were still like 16 years old back in the day.
Well, maybe there's some different child labor laws up here.
That's true. All right, guys, 888-659-3727. I know that was a long call, but this guy's about to make a decision that will change the rest of his life. I thought it was important to try to give him as much insight, information as possible.
To hammer him into submission.
Right. And I hope we did. Hey, man, you're on the air. Who's this and where are you calling from?
Hello?
Yes, hello.
Hello.
Hi.
Hi.
Yeah, this is Mohammed. I had 2 quick questions. So what's your opinion on
Dude, you got I know you called before. I recognize your voice, but
Ahmed from Toronto, right?
Jersey.
That was my second guess.
Yeah, close.
Yeah.
Yeah, I was close.
Yeah. What's your take on microneedling or derma rolling? Like, obviously in conjunction with like other therapies. And then also the second question is, if you've heard about Trinov, the Bratsu lotion, it is developed by like a pretty legit company, Fidia Pharma. But I read like some people.
Ahmed, stop. It is not developed by a air quotes legit company. It was developed by this old fogey doctor in Italy.
First of all, I'm taking the camera off me before I make too many faces. I'm gonna let Joe take care of this.
Respectfully, Trinov was developed by I forget what kind of doctor it is, but the company that's marketing it now, they purchased the rights to it. They didn't develop it, as far as I know. I could be wrong, but that's what I remember the case being. What I think about it is that I haven't seen anything impressive. In fact, the presentation, I forgot how long ago it was given. I think it was not quite a year ago. Yeah, about a year ago. Some doctors I know that went to the presentation said it was a very uninspiring presentation, that there were really no impressive results to be seen that would say, wow, this is great.
I heard from physicians that there were no reasonable results and that the imaging was off and that they really were shocked that this was presented in this fashion.
Yeah. Well, bottom line is the doctors I spoke with all said, don't don't waste your time with it. It was very haphazard presentation. So, and ever since it's been released, nothing has shown me to think otherwise. As far as microneedling goes, microneedling, there's some YouTube videos out there which really are designed to do nothing more than to get your eyeballs to watch the videos. That's it. Microneedling, there is some potential benefit on a very small level. I think that personally microneedling is better when you're trying to activate PRP, when you like right after a PRP session and using it for the first few months afterwards. That's the way I was shown how to use it. I have my microneedling, my roller, and I can say that there is some very anecdotal evidence that occasional microneedling, like once a week, can help boost a little bit of fullness, but you really have to be paying attention to see anything, and it's just too iffy. I mean, there's nothing concrete. There's nothing that definitively says, "Oh yeah, you got a microneedle. It'll make a big difference for you." There's nothing out there, and I think that when you start looking at these fringe treatments, you're potentially wasting your time, because nothing out there, nothing that you have to search for to find information about in any meaningful way is going to make a difference for you.
Look, microneedling is known as collagen induction therapy. Okay, somebody fucking just named that shit. They put it out there. As far as any true scientific data, it's very limited. I have seen some improvement in skin tone with some people, even myself when I was trying it for a while, I kind of gave up. But as far as hair, the only thing that I can actually say with confidence is if performed, and Joe, I don't know if you said that you saw it being performed after PRP. Usually, in my experience, at least from what I know, it's performed, you want to do the collagen induction therapy before PRP. So first you set that all up, and then you do the PRP injections, and then you also kind of layer the scalp with some PRP as well, once you've already created those wounds. That's it. And maybe it can help with the absorption, obviously, because you're creating holes in your scalp with other medication. I don't think it's going to do anything. And again, I'm not a physician. This is just my opinion based on years of experience, and also kind of knowing the guy who started all this cell-based therapy with microneedling. I think it has very minimal effect on anything when it comes to hair.
All right.
I don't want to disappoint you, man, but look, Joe's right. If you have to look something up, if you have to fucking scour the fucking internet for hope, it's probably not something that you want to invest much time in.
All right. Thank you.
All right, man. Good luck.
Thanks for calling.
Bye.
We just bummed another kid out. Sorry, Mohammed. Take it easy.
Really did.
I want to help these guys, but the only way I can help them is tell them the fucking truth.
Well,
this is the bald truth.
Oh, see,
no,
you're waiting for that opportunity.
No, but this isn't, let's figure out how to do home PRP, or let's talk about gray market bullshit, or this is the bald truth.
Or how to do our own body hair transplant.
Yeah. Sadly, the bald truth is fucking disappointing. We make our living and just do our thing for, this is our career. We unfortunately have to disappoint people by letting them know that most everything out there is bullshit.
Yeah.
It sucks. And I have to tell you, I would get a lot more eyeballs if I were one of these guys just talking about every gray market product and putting out videos about that bullshit and allowing the Fall Truth talk forum to be filled with this nonsense. But I had to make a decision to say, you know what, man? The eyeballs are great, the traffic is great, but these people are being misled. And that's not why I started doing what I do. Let's take a phone call.
Well said.
Hey, you're on the air. Who's this and where are you calling from? Hey, man, what's up?
Hello?
Hello.
Hi, this is, can I use a made-up name?
You didn't even have to tell us that, but of course you can.
Okay. Well, Say, Brill from Calgary, Canada.
What is your name?
Brill.
Brill. Why couldn't you make, if you're making up a fucking name, why can't it be like Joe?
Or Bob.
Something easy.
Okay, please take Bob.
Bob from Calgary. Bob, welcome.
What's up, Bob?
Hi, Joe. Hi, Spencer.
Hi.
I have two questions, if possible. The biggest one I wanted to ask is about the video that Joe made. Do not get a hair transplant.
Yep.
Saying that, what are you going to do if it doesn't work? I was wondering if you're able to expand a little bit. I did a bunch of research, and I kind of know where you're going with this. Because Spencer mentioned one of his dialogues before that there's a possibility of shock loss. I guess that's one of the items. So I was wondering, would you be able to talk more about that?
Well, obviously the question is addressed to Joe, but you mentioned me for a second. And I had a very interesting interview with a doctor yesterday, and he said something that no doctor has ever said on the show or any place else in public, but they've said this to me behind the scenes. He goes, what a lot of physicians are calling shock loss, it's not shock loss. It is follicle damage. They are destroying hair follicles, adjacent hair follicles, when they are trying to do either dense packing or placing grafts where grafts should not be placed. He says it is something that is really underestimated out there, and a lot of these people are permanently damaged. Just want to put that out there.
That's the confusion with shock loss, where I explain that in my hair transplant glossary on my website, where I break it down.
Hairtransplantmentor.com.
Hairtransplantmentor.com, glossary.
Biggest glossary in the history of glossaries.
Not that big, but thanks.
Yeah.
It breaks down that there's shock loss due to just shock, just the interruption of blood flow, and then there's shock loss due to follicular damage, as Spencer was talking about, where the angle and direction of the incision is not parallel to the neighboring follicles, and it crosses over and cuts and kills them. And there are other reasons too, but the issue of do not have a hair transplant, or the point of do not have a hair transplant, if you haven't thought about what you do if it doesn't turn out, there's nothing really to expound on, except for it's just designed to get you to think, because so many people are looking at the pretty pictures
online. Hold on for a second,
online.
Joe. What is that sound coming from this guy's phone?
Don't know.
Maybe my breathing. I don't know.
Stop breathing, dude. Go ahead. I'm just kidding.
Hold your breath.
Yeah.
What was my thought? Where was I?
You
oh yeah, it was just to get you to realize that there is another side to the story, or of the potential story, besides what you're seeing in the on the websites and and maybe the brochures that you see with the pretty pictures of people with sad faces and bald heads going to smiley faces and full heads of hair. Like, if it doesn't turn out like that, then what are you going to do? Have you thought about this? Because if not, you need to look into the dark side of this. You need to understand that not everyone turns out with a great result. Not everyone's happy. Every doctor out there that has any sort of time on tissue has unhappy patients. Whether it's justified or not, they have unhappy patients, but they all also have patients that have had poor growth, wide donor scars, or bad scarring from FUE, mismanagement of the donor area. All kinds of issues can pop up. So the point was to get you to think about this and to look beyond the pretty pictures, look past the marketing and what people are telling you, which is all only designed to get your ass in the chair. Does that make sense?
Yeah. I was listening to a bunch of your recordings, and you guys did mention that a lot.
I need to interrupt you for 1 second. There's a guy in the chat room, Joel, who's asking if the podcast can be put back on iTunes. First of all, that is my fault. There will be, I promise you guys, there will be this week's and last week's put up over the weekend. So we will start, and I decided instead of going backwards, I'm just basically going to start from the latest episode and then move backwards, as opposed to trying to find the stuff that's out, that I have and get the date right and all that shit. No one gives a shit about that. They just want to listen to the show. So anyway, I apologize for that. Yes, to answer your question, it is a lot of work, but we're going to make it happen because everyone's asking what's going on with the podcast. So caller, I hope Joe was able to answer your question to some degree. I know you have more questions. Thing is, what he's trying to tell you is surgery is always a last resort. These are the possibilities that could happen when you're having surgery. And he wants to get people's attention to be like, wait a second. I may be the hair transplant mentor, but you probably or might not be a candidate for a hair transplant. He was just trying to get your attention, and he did. He got a lot of people's attention. And frankly, there's some people who are upset with him, who are like, why are you telling us not to get a hair transplant when you got fucking, 9 hair transplants?
Right. Exactly.
Because Joe is the anomaly. Joe is not the typical patient. Joe is not the guy, the average hair transplant patient.
But I also didn't have a great outcome in all of my, they're my first 2 procedures where I had to have a repair. But on transplant number 5, I think, with Dr. Wong, my donor scar stretched. He fixed it, but that's another example of how it doesn't always turn out. I mean, right now, my donor scarring situation is pristine. It couldn't be any better. But after one of the procedures, though, there was some stretch back, and he cut it out, and we redid it, and it worked out fine. But I'm an anomaly, but I'm also just like everyone else, where shit happens. So.
Yeah, I understand. Thanks for that. I'll look into the glossary too, by the way. My second question is about finasteride and pregnancy. I do plan. I'm 31 years old.
Dude, first of all, do not get pregnant if you're on finasteride. It's a joke. Sorry.
Crickets.
Jesus Christ, man. This is a fucking tough room tonight, man. Go ahead.
Based on what I read, you're supposed to be off finasteride if you're trying to conceive. So I wanted to ask, would topical finasteride be a replacement?
Well, based on what you read, I'm not sure where you read that, but based on what you read, that's probably anecdotally. I'm not saying that you shouldn't be. I've been telling people for years, for 21 years, that if it were me, I would not take that risk. You don't want to be the anomaly, having the fucked up kid because you're on finasteride, or something happened and then you not knowing why it happened and you thinking it could be finasteride. But I will say that at least clinically, and at least according to the drug manufacturer and most physicians, it is fine to be on the drug and to conceive. But again, as a human being, I would not recommend that, and I would never take that chance. But there's nothing clinically that shows that there's been any adverse effects for someone getting somebody pregnant. You look at a guy like Specs, he has 2 healthy, normal twins. I have had friends who've had kids who've been on the drug, and I've never heard of a single case where there's been any type of a birth defect because the male was using finasteride. But I got to repeat myself. For those who are going to cut this out and take it out of context, I don't recommend it. I would get off of it. To answer your next question, will topical finasteride make a difference? You're probably going to have less in your body, obviously, because it's going to be less systemic, but there has to be some systemic action, something that it has to get into your bloodstream in order for it to work. So even if it's topical, you're still putting it into your bloodstream. And if you have the slightest concern about impregnating somebody while finasteride is in your body, then I would say, and again, I'm not a doctor, stay away from it. Joe, what are your thoughts?
I agree.
I concur.
I understand.
Hope that helped. Hey, again, ruin another guy's day. But
no, I get it.
Look, you can make a choice not to have a fucking kid. That's what I did. Hair kid, hair kid, hair kid. I chose hair.
Yeah, I wish. No, I can't. So my third question is...
Why not, Bob? You could do whatever you want.
That's true, but I made this decision.
He's like, who?
Sorry, guys. So third question. So I I thought about surgery a little bit, and I did have a consultation with the current consultant at Hassan and Wong this year, and they did say I'm
at the clinic or remotely.
Remotely, the guy who travels.
Mike.
James.
No. Yes.
Yeah.
James.
Yes.
Yes, James.
Okay.
Yeah. And so I went through the consultation, and he said I am a candidate for the transplant. So I just wanted to ask you, in your experience, does blonde/ginger hair make a big difference, like in terms of difficulty of the transplant? I'm just curious.
I'll let Joe answer this, but I have my opinion.
Well, is your hair straight or wavy or curly?
It's pretty straight.
Okay. Then it's usually well, you got a couple things. First off, if it's more of a blonde color with just a little bit of ginger in it, but if it's mainly a blonder color, you probably have larger hair groupings, more 3 and 4 hair groupings than people with other hair types, and that would mean that you would potentially get some great coverage from the procedure. It also tends to look more natural when looking up close because there's very little contrast between the hair color and scalp color, assuming that you're some sort of Caucasian, obviously with the blonde hair. So yeah, I mean there's some benefits to it, and you can have the appearance of better coverage with fewer grafts, again because of the low contrast. There can be some challenges working with the hair because that low contrast actually can work against you when the technicians are dissecting the grafts through the microscopes. It's a little bit more difficult to see the entire follicle, but it's still doable. So if the team is experienced, I mean, I'm talking generally, not just about Hassan Wong, but when the clinic is experienced, the technicians are experienced, it really isn't a hindrance or an issue.
Okay, I understand. Thank you. Just one more question.
Okay.
Can you please tell me about the FUT scar? Do you, like, when they take out the strip, is there nerve damage? Like, do you not feel that part of your head anymore?
Great question. Fact of the matter is, when I had my first 2 procedures before I met Dr. Wong, I had permanent numbness, permanent nerve damage that was along the entire vertical of the back of my scalp, from the donor scar upward into the crown. It was all numb, and it was like that for 9 years. Interestingly enough, after Dr. Wong cut out the 2 scars I had 2 donor scars, horizontal, one above the other. Once it healed up, the feeling returned. So if you go to a clinic that knows what they're doing, and their specialty is strip, and they've been doing it for many, many years, the chances of having permanent long-term nerve damage are very low. It's not a guarantee that you won't have permanent nerve damage because nerves are cut. It's just when you have good scar formation, then it's easier for those nerve endings to reconnect. They grow about 1 millimeter per month, so it takes a while for those connections to reform. It usually takes several months, but it does return usually, and yeah, it's not impossible, but it's rare to see that happen in good clinics.
Okay, I understand.
All right, man. Is that it?
Yeah, that's it. Thank you so much.
All right, Bob.
I like your show.
Say that again.
Thanks for calling, Bob.
Thank you. I said I like your show a lot.
Oh,
thank you.
Listen, man. Thank you. I really appreciate that. Not Bob from wherever you're not from.
All right, guys.
Take care. Bye-bye.
Bye-bye.
Guys, the phone number is 888-659-3727. We have a few more minutes before we decide to get the F out of here. So if you want to call in, now is the time. Otherwise, if we get no more phone calls for today, we call it a day. And by the way, Joe, I think that the studio looks fantastic.
Thank you.
And it sounds so much better. It's insane.
Really?
Yeah.
Awesome. Thank you very much. I appreciate that.
Yeah.
I'm not done. Still got more stuff to do, but yeah.
There's no reflection coming off the walls. It definitely sounds like there's nothing coming from the ceiling. I mean, coming from the floor, like I thought there was before.
Well, there we go.
And the panels that you built are really professional looking, and they work.
I kind of wish I'd gone with black. It's a little too bland, but no, I appreciate that. It was
spray paint those bitches.
So.
I'm just kidding. You can't paint them. You have to use a special paint.
Yep.
If you're going to paint them to absorb the sound.
Exactly.
I forgot what that's called.
Sound absorbing paint.
Sound absorbing paint. Or what you can do is, I mean, it really wouldn't take that much to just recover them. Don't take the covers off, but put some, like, you know, I'm not going to say black velvet, but some sort of a plush black.
But the sound still has to be able to go through the fabric. The test is that you have to be able to breathe through the fabric,
right,
and feel it on the other end. If I start putting more fabric on top of it, then that kind of defeats the purpose. So
hire
but
somebody.
Thanks.
Get an intern. Do the fucking work for you. Let's see who this is. Hey man, you're on the air. Who's this, and where are you calling from?
You are, mate. Steve from London.
Hey, what's your name?
Hello, Steve.
Steve, what's happening, man? How are you?
I'm good, mate. I'm good. I was just listening a bit, and I won't lie. I come away from watching you. I really only picked up and engaged a lot with the first caller because he seemed so affected by his hair loss. And I don't know if he's still in the chat room, but my advice would be aimed at him. Because I've rang before you lot, and I'm like Spencer, 100% against surgical procedures to make yourself better, more acceptable in society. So,
well, I'm not. I will say that that's not the way that I feel. I am for certain surgical procedures if it's right for you and for yourself. Period. But for me personally, surgery isn't an option.
Yeah, so, okay, your personal opinion, and so that's exactly, I mirror that myself, right? So, because I'm comfortable within my own skin, I am who I fucking am. I ain't changing for no one, and I don't feel like I need to change for anyone. So, but, I mean, I will say this as well. I'd be at liberty to say I wasn't worried about my hair loss because I've gone down the medical route myself, just like you Spencer. So, I've taken Propecia. Since 2004. Well, I'm only classing from 2011 because I was getting this other stuff from China before then. So I don't know whether it was working or what was in it. So I'm not even taking that into account, to be fair. I was only on that for about 6 months, so I didn't really see any change anyway. But I think Joe makes a very good point as well regarding the manufacture of these drugs, because I have tried a few brands myself, right, and I can definitely notice a difference in the quality, like you say. I mean, even if I've cut them up with a pill cutter, I've noticed the branded stuff, the Propecia, it's much more. It seems more consistent when I cut it. Because sometimes I cut it because I was only trying like a half at first, but I went to the cheaper stuff, and I find if I cut that, it fucking crumbles. Do you know what I mean? It just doesn't seem as well put together as the Propecia. And I mean, this is going to sound weird. I've even done a test myself, because when I ordered the stuff, I thought, is this really the same? Because it's so much cheaper. You know, it's not going to be the same. It's like buying a fake item of clothing and buying the real thing, right? So I put them in like water. I know this sounds weird, to see how they would dissolve and what one. And, you know, the fake ones, it went like a balloon, it swelled up. But then the Propecia sort of stayed, it took ages to dissolve itself. So I sort of, no scientist, but I tested that. But I will say, Propecia has kept my hair, probably a minimal loss, but from 2011 till now, mate, by rights, I shouldn't have a hair on my head if I went in the way of my father. So anyone thinking about not taking this drug because they're scared of the side effects there, just fucking take it, right? And at first, I had a few side effects, but the side effects were, I did get a bit of desire not to have sex and that, but I just rid them out, because I thought I'd rather like keep my hair for longer than have sex. The way I was feeling, and I'm sure I'm not the only one that feels that way, right?
There's believe it or not, there's a lot of guys who feel that way. And it's not about whether or not they want to have sex, or they'd rather have their hair as opposed to having sex, but they feel like, okay, well, if things aren't exactly the same, they could live with it because they want to be able to maintain a head of hair, and they may be not as amorous, or they may be functioning slightly differently, but for them, it was worth it. So there is a large percentage of guys, believe it or not, who feel that way. And then there are guys out there who are like, you are fucking crazy. There's no way I would sacrifice my sex life in any way, shape, or form. It's a matter of personal preference.
Yeah, and also I feel it's a matter of whether you're single or not. Because if you've got a girlfriend and you've got a wife, you're not going to care as much as if you're single. That's how I felt. That's how I personally felt. Because I thought, I've got to keep this on my head. Otherwise, I'm not going to be attracted to that woman. And, you know, anyone that had a full head of hair, I got insecure around if they were talking to someone I liked. I thought, no, I can't not lose my hair because I really like this woman and she's going to like him better because he's got hair and I'm fucking losing mine, right? But it was probably when I hit 30, I started to realise many of the young ones need to take this advice. When you get older, it's bad at the time. I feel when you're in your 20s, it's because it's happening. You're starting to change. The older you get, you're going to realise there's more important shit in life. And just stay, if you're on the Norwood scale, if I'm looking at it, if you're like a Norwood 3 to a 4, whatever, 2 to a 3, that's when the medication, I feel, is necessary. If you're that concerned about your hair loss, and you for me anyway, you're going to, and Spencer, I mean, you've kept your hair, you're in your 50s, right? You've kept the majority of it.
I lost a lot. I mean, I have a lot of loss, I would say, I'm losing Joe, sorry. I have a lot of loss in the back, which I cover up pretty well. But yeah, I kept enough where I'm able to style it and dummy it up, and I'm going to be 54 years old. So for me, it was life-changing.
Yeah, you're doing a good job. You know what I mean? Because then what Joe was saying to the first caller, I'd echo that, and I'd say, look, mate, if you go in for a surgery, even with the best in the world, you're not guaranteed any good outcome of like any surgery. And how are you gonna cope? You know, how are you gonna cope?
Oh, sorry,
yourself?
guys.
Well, my Skype going there.
No, I just had to try to call Joe back. There he is. No, and it's true. How are you going to cope if surgery doesn't go well? And that's a question that no one asks. You don't see any Facebook ads saying hair transplant surgery. You know, there's no NeoGraft ads or ads for local hair transplant guys posing the question, what if your hair transplant doesn't work out? It doesn't work that way. No one even thinks that that's a possibility. It's never presented to them in any way, shape, or form by this industry.
Right.
No, I've seen that as well, mate. And I've seen when it does go wrong, that it does have a big effect because the majority of people don't speak up about it. They don't want to talk about it because they're so cut up by the fact that they've gone in for this surgery, spent thousands, and it's not worked for them.
Well,
absolutely. They're a lot of times they're embarrassed that they don't want to be called out for being punished for their vanity. A lot of times when people talk about this, where just in general discussions, you'll hear comments about how it's such a vanity issue to even consider doing something like that. And it's like, well, of course it is. Everything the shirt we put on our back for the day is a vanity issue. We want to look good, but these guys that are having these problems where they go to some clinic that's really screwing them up, they don't talk about it because they're embarrassed. They don't want to be looked upon as weak and made a stupid decision that that they're stuck with for life. In many cases, it's a fairly common issue, very common issue actually.
Yeah, I see that, and like your first caller there, I mean, what you was asking, how would he cope? I mean, obviously, I've not been through it, but I will tell you now, I would feel probably 100 times worse, mate, if I went in for a surgery and it come out and it didn't go the way I was expecting, or my expectations weren't met by it. I'd be devastated. I would be in a worse position than when I went in, and I would probably beg for it to be reversed, right? Which obviously then you haven't got that option.
Well, you don't have that option. And I was talking to a doctor yesterday who, was telling me a story about a patient who came in crying, who went, and he went to a local well-known clinic, and he came in crying, asking if they could somehow reverse this. And he's like, I could improve things, but there's no reversing this, man. I am sorry. And he also said something very interesting, and I was like, I mean, it totally resonated with me. He believes that, in general, first-time patients do the least research. It's the second-time patients who do the most. And I've always said that the people that find the American Hair Loss Association, the IHRS, the Bald Truth, and all of our resources, Hair Transplant Mentor, whatever, are usually the guys who've already been fucked up. Not saying the guys who haven't been fucked up don't find us, but they aren't the guys that are just going to the top 3 searches that are paid for and making a choice.
One of my observations is that it's, the people who do the most research are the second-time patients, but the group that does the second highest amount of research, from my experience, are people that just had a hair transplant.
Yes, that's so true. And they're like,
oh
my God, what did I do?
And then they start, then they start doing the research. Then they start, learning about propecia. Then they start learning about the wrong way to do transplants. Then they start learning about wide donor. It's like, and that's horrible because they don't know what their result's going to be like. I'm talking about people that had it like a week prior. And then they decide to start going online. They see all the horror stories.
I tell people, unless they've had a bad experience, stay away from the internet. Stay away from the internet for at least 6 months. If you've already cut yourself, you've already done it, stay the fuck away from the show, the internet, anything. Live your life. Because you may never need to call us. You may be very happy in the end. And that 6 months of agonizing on whether you made the right decision is worthless.
Yep.
And you know what? What you do is good, because I feel where people need to find you as well, that a lot of people rush very, very quickly. So when I read things on the internet and I see people that I know, so if, for example, their hairline's starting to recede up, what they're not aware of is that might stay there for 10, 20 years. But they're rushing to get these transplants, which, if anything, from what I've seen, can sometimes accelerate the loss around where they've had that hair put in.
Yeah. Why the fuck do you think I don't get it done, man? I have too much hair to lose. That's it.
Yeah. Because it's logic, isn't it? If you put in hairs that are probably more dominant from what they need to be supplied with, then everything around it, it's not going to get sufficient. I suppose it's like planting a row of trees, isn't it? And
well,
there's trees.
In a sense, but usually there's damage done to peripheral hairs, or at least temporarily. So a lot of people look worse than at first than before the surgery. But like the first caller, while we weren't necessarily talking about a surgery, we just wanted him to make sure that he knew everything he needed to know before he made a decision. But as far as the way he described his hair loss, he makes at least the amount of hair loss that he has for a better candidate for hair transplant surgery, because he's not had hair for a while in that area. And it's the younger guys or the newer guys that really, I believe, make the worst emotional candidates for surgery, because they remember what their hairline used to look like. You get a guy who's a Norwood 5 and you put a new hairline on him, he is fucking ecstatic.
Yep.
It's life-changing.
And it goes, doesn't it, with what you say? It's got to be the right time as well, because if you're in a position like where you've been a Norwood 5 for a long time, then your outcome's going to probably be a lot better than someone that's just like Norwood 3 or 4 rapidly within the space of a year or so.
Well, they realize they like, wait a second, now my face is framed. I've missed this for the last decade of my life. I have it back now. They don't expect their expectations are very realistic. And to me, those make the best candidates for hair transplants. I think that physicians who are considering getting into this field or are new to this field or who are even in the field for a long time need to keep that in mind. That, you know, I used to say on the air, and it pissed doctors off, but I still believe it. If you're below a Norwood 3, try to live with it. Don't have a transplant.
That should be your slogan, because I agree with that now, 100%. Because a lot of people don't even progress beyond the Norwood 3. You know, there's a lot of people that don't. I mean, I've got friends that have probably been Norwood 3 for 20 years, coming up 3 decades. And what I find, that I'm probably like used to, I can look at someone and think, yep, you're going to lose your hair, yep, you're going to lose your hair. And what I find that the people that start, with the hairline starts to recede, they tend to hold on to their hair longer than someone that starts to thin in the crown. I mean, I don't know if you'd agree with that.
You know, I think that's observational, and I don't necessarily agree with that. Usually, I from what I've seen over the years, the guys who start to recede will eventually, you'll start, you know, within a year or two of recession, they'll start to actually lose some in the crown, and eventually that just kind of comes together. So the crown and the hairline meets.
The only reason I say that, because I notice a lot of men with like receding hairlines, but the rest of their hair, even the crown, still looks strong, thick, and healthy.
Oh, yeah, well, I will tell you, I'll give you an example. James Woods, the actor, I saw him at a local deli in Beverly Hills, and this guy has been in Norwood 3, a little beyond the Norwood 3, with thick hair since he was young. And when you see him in person, he has a thick, white head of hair with deep recessions. But he just kept it, and he looks really good. He actually looks better now as an older adult than he did when he was young, because
I agree.
He was balding, it seemed significantly at a young age, but it just stopped. Listen, Steve, we got to go. I always appreciate the call. Thank you so much for taking the time to call all the way from the UK. It's very much appreciated.
Thanks for calling, Steve.
All right, take it.
All right, you take care. Okay, bye-bye.
Bye now. Bye.
All right, guys, we're going to call it a night or a day or afternoon or whatever it is. Whatever time it is where you are, it's Miller time where I am. Right? Well, it's been Miller, well, it's Budweiser time, I guess. But, Joe, any news? Anything you want to share? Anything new? You want to talk about the forums that are embedding this broadcast for their users to enjoy?
I will mention our friends at hairlossexperiences.com, primarily a UK-based internet web forum talking about hair loss and hair restoration. But being the interwebs, we've all got access to it, and it is a great resource that is just they have just updated their software. Great new forum platform. Go check them out. That's hairlossexperiences.com. Then we have our Italian friends, bellicapelli.forumfree.it. Guy that runs that is a repair patient, same as guy that runs hairlossexperiences.com. Repair patient. I've known him for many years. Great supporter of the program, great friend of the program. bellicapelli.forumfree.it. And finally, we have international-hairlossforum.com. That is the French hair loss and hair restoration forum. Also a great resource for looking at patients and investigating doctors that aren't, I don't think there are any North American doctors there, but if you're looking for a European option, they've got plenty there, as well as their patients that are sharing their experiences. That's international-hairlossforum.com.
And if I get one more email about some fucked up webinar, I'm going to throw this phone out the fucking window. I mean, people are still doing webinars. It's 2019, people. It's like these guys when they set up a conference call and you got to call in a number and put in this fucking code, and no one's like, everyone's like, are you there? Are you there? There's got to be a better way. And there is. Sorry. It's just a frustrating week. Guys, Joe's website, hairtransplantmentor.com, for everything Joe Tillman. You can check out Joe's personal website. Also, anyone who's in Joe's chat room, I just took a look, like the fucking show. It's not a big deal. Just press the like button. And anyone who's listening to this broadcast through the many live resources like Stitcher Radio, iTunes Radio, iHeartRadio, check out Joe Tillman's personal YouTube page. Is where we actually air this video portion of this broadcast, or part of it. And it's youtube.com//hair transplant mentor, and subscribe, hit the like buttons, hit the bell so that you get notifications and all that stuff. And guys, there will be 2. I'll give you my word, or at least 1. I can't give you my word. I'm going to make it happen, and hopefully the
I'm
guy
gonna try really hard.
Yeah, and hopefully the guy uploads it. There'll be 2 new podcasts on on iTunes. So go to iTunes, look up The Bald Truth, subscribe to the program. We're going to start rocking it this year again. So all of our broadcasts will be on the podcast through iTunes. Also go to thebaldtruth.com for archives of this broadcast as well. But do me a favor, subscribe to The Bald Truth. It takes a second. Put your email address in there. We don't send you any bullshit. We do not sell your email addresses, even though there's some companies that have contacted me over the years who want your fucking information. But that's not going to happen. Just put your email address in there, and you will be notified every time a new show, clip, segment is put up on the Bald Truth website. So check that out. The International Alliance of Hair Restoration Surgeons, that is IAHRS.org. If you're considering surgical hair restoration or hair transplant surgery, listen, it's a great place to start to do your research. It is now in its 19th year as an organization, which is fucking insane if I think about this, how long we've been around. And I would say that got a pretty good track record. A lot of happy patients over the years have come through the IHRS, and I'm very proud of what we've been able to accomplish with the organization. And this year, it's going to be bigger and better than ever. And that's not hyperbole, my friends. We're doing a lot of interesting stuff.
I've heard about it too.
Shit just got real.
Shit just got real.
Guys, until next time, be strong, God bless, and thank you so much for listening. Have a good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.
Bud Light presents Real American Heroes.
Real American heroes.
Today we salute you,